The pigment in the back of our eye is entirely of dietary origin, thus suggesting that the most common cause of going blind in the Western world could be delayed or even averted with appropriate dietary modification. Reversal to such a degree that even patients who could no longer distinguish any objects have been able to read fine print. A reversal of blindness with diet.
Meet Dr. Michael Greger, a renowned physician, author, and public health advocate, who promotes plant-based nutrition not only to prevent chronic diseases, but also to support overall health. As the founder of nutritionfacts.org, a nonprofit organization providing free, evidence-based nutrition research information, Dr. Greger emphasizes the importance of a whole food, plant-based diet for optimal eye protection. In his work, including his best-selling book, How Not to Die, he highlights specific nutrients crucial for maintaining eye health and preventing conditions such as cataracts and age-related macular degeneration. In this video, Dr. Michael Greger will help us discuss 5 supplements that can help protect the eyes and reduce vision loss. These supplements not only help prevent age-related degeneration, but also safeguard our eyes against common eye problems. But that's not all. In addition to these supplements, we will also share practical tips for the prevention of dry eyes through diet. So stay tuned with us until the end.
Yes, oxidation and inflammation appear to be key to both Alzheimer's and macular degeneration, but neither disease seems particularly amenable to late-stage treatments. That's why prevention is the key. Reducing oxidation and inflammation in the earliest stages may be our most promising approach.
Before we dive into our list of 5 supplements that protect eyes and reduce vision loss, let's briefly discuss the common causes of vision loss. Common eye problems include age-related macular degeneration, cataracts, dry eyes, and vision loss due to oxidative stress. These conditions are often linked to aging, inflammation, and environmental factors like UV exposure and blue light. Other contributing factors include poor nutrition and chronic health conditions, such as diabetes and high blood pressure, which can exacerbate vision problems. By addressing these root causes through proper diet and supplementation, we can help slow the progression of vision loss and maintain optimal eye health for years to come. So without delay, let's jump right into the first supplement on our list. The first supplement is lutein. Lutein is a powerful antioxidant belonging to the carotenoid family, and it plays a crucial role in maintaining and protecting eye health. Lutein, along with its counterpart zeaxanthin, is concentrated in the macula, the part of the retina that is responsible for sharp, central vision. These two carotenoids act as a natural defense system for the eyes by filtering harmful blue light and neutralizing free radicals, which can cause oxidative damage to the retina.
Lutein is the dominant dietary pigment in the retina of the eye, as well as the brain. And so not surprisingly, that macular pigment, the concentration of lutein in the center of your eye called the macula, was found to be significantly correlated with levels in the brain, which may explain the link between how much of these greens nutrients you can see in the back of the eye and cognitive function. The neuroprotection is assumed to be because lutein is such a powerful antioxidant, but it also has anti-inflammatory properties.
One of the primary eye conditions lutein helps prevent is age-related macular degeneration, a leading cause of vision loss in older adults. Studies have shown that higher lutein levels in the diet are associated with a reduced risk of developing age-related macular degeneration, particularly in the more advanced stages of the disease. By absorbing blue light and reducing oxidative stress, lutein protects the sensitive retinal cells from damage. In addition to that, lutein also helps prevent cataracts, a condition where the lens of the eye becomes cloudy, leading to impaired vision. Its antioxidant properties may slow the development of cataracts by protecting the lens from oxidative stress. Visual performance is another area where lutein shows benefits. Higher dietary intake of lutein can improve contrast sensitivity and visual sharpness, making it easier to see in low-light conditions or in environments with glare. Lutein is best obtained through a whole food, plant-based diet, which naturally includes lutein-rich foods. Leafy greens, cruciferous vegetables, peas, corn, orange, peppers, and avocados contain a good amount of lutein. Because lutein is fat-soluble, it is important to consume these foods with a small amount of healthy fat, like avocados, nuts, or seeds to enhance absorption.
Pills, though, adding as little as 60 grams of spinach a day for a month, that's like 1/5 of a 10-ounce package of frozen spinach, can significantly boost macular pigment in most people.
Dr. Greger suggests consuming around 6 to 10 milligrams of lutein per day to protect eye health. This can easily be achieved by incorporating generous servings of leafy greens and other vegetables into daily meals. For example, a cup of cooked spinach contains about 20 milligrams of lutein, which is more than enough to meet daily needs. Before we continue, please note that this content is for informational purposes only and is not intended to replace professional medical advice, diagnosis, or treatment. Always consult with a qualified healthcare provider before making any changes to your diet or taking new supplements. Our next supplement that can protect eyes and reduce vision loss is zeaxanthin. Zeaxanthin is a carotenoid, a type of pigment that gives certain plants and vegetables their vibrant color. A forever partner of lutein, it is one of the key nutrients found in the retina of the eye, specifically in the macula. Zeaxanthin plays a critical role in eye health by filtering harmful high-energy blue light and acting as an antioxidant to protect the eye tissues from oxidative damage.
You don't have to take pills, though. Adding as little as 60 grams of spinach a day for a month, that's like 1/5 of a 10-ounce package of frozen spinach, can significantly boost macular pigment in most people. And it's not just good for treating diseased eyes. A randomized, placebo-controlled study found that these greens goodies can improve visual processing speed in young, healthy people. That's like when you're trying to hit a fast ball and your body has to start reacting before you even consciously register it. With real-world benefits outside the major leagues.
Zeaxanthin helps prevent and protect against several common eye problems like age-related macular degeneration. Zeaxanthin and lutein form a protective shield over the macula, helping to reduce the risk of AMD, a leading cause of blindness in older adults. Studies have shown that a high dietary intake of zeaxanthin is associated with a lower risk of developing AMD. That is not all. Zeaxanthin's antioxidant properties also help protect the lens from oxidative stress and UV light damage, lowering the risk of cataract formation. It filters out damaging blue light from screens and sunlight, reducing the strain on the eyes and protecting them from potential long-term damage. Moreover, adequate levels of zeaxanthin contribute to better visual acuity and contrast sensitivity, enhancing overall eye function.
The most protective dietary component, decreasing the odds of glaucoma by 69%, consuming at least 1 serving a month of collard greens or kale, just once a month or more. And the silver and bronze medals go to weekly carrot and then peach consumption. We think it may be the lutein and zeaxanthin, 2 yellow plant pigments found mostly in greens, that seem to know right where to go. They hone right into our retinas and appear to protect against degenerative eye disease.
Zeaxanthin is found in various fruits and vegetables, particularly those with bright orange, yellow, and green colors, like corn, broccoli, egg yolks, orange bell peppers, zucchini, and goji berries. Including these foods in your diet can help increase zeaxanthin levels in the retina and improve eye health. Before we move on, if you're looking to dive deeper into how diet can protect your eyes and boost your overall health, be sure to subscribe to the QuickTime newsletter linked below. Each week, we share expert-backed tips, delicious recipes, and actionable steps to help you live longer and feel your best, delivered right to your inbox. Next in our vision protection team is ginkgo. Ginkgo biloba is a traditional medicinal plant that has been used for centuries, mainly for improving blood circulation and cognitive function. When it comes to eye health, ginkgo's role centers around its ability to enhance blood flow and its antioxidant properties. One of the key ways ginkgo may protect the eyes is by improving circulation to the optic nerve and retina, the light-sensitive layer at the back of the eye. Poor blood flow to these areas is often linked with eye conditions like glaucoma and age-related macular degeneration. Glaucoma, especially, is characterized by damage to the optic nerve, which can lead to blindness if untreated. Ginkgo's ability to enhance blood flow could potentially slow down the progression of this damage.
Ginkgo biloba is one of the most common supplements taken by glaucoma sufferers. It doesn't seem to lower intraocular pressure, but MRI studies suggest ginkgo supplements may increase cerebral blood flow in the brain. What about blood flow to the eyes? Ginkgo increases ocular blood flow in both normal and glaucomatous subjects.
Some studies suggest that ginkgo may help in open-angle glaucoma, the most common type, by improving pre-existing visual field defects. Taking 40 milligrams of ginkgo extract twice a day alongside regular anti-glaucoma medications appeared to significantly slow the progression of visual defects in patients with open-angle glaucoma, the most common type of glaucoma. This suggests that ginkgo biloba may have a beneficial role in slowing the progression of the disease when used in combination with standard treatments. By neutralizing free radicals, ginkgo could reduce oxidative stress on the retinal cells, helping prevent long-term damage. Unlike vitamins or minerals, ginkgo biloba is not naturally found in whole foods or diets. It is generally available in supplement form, usually as an extract from the ginkgo biloba tree. Therefore, it isn't associated with any specific diet, but is often included in holistic, health-focused dietary plans. The typical dosage of ginkgo extract used in studies ranges from 120 milligrams to 240 milligrams per day, often divided into 2 doses. For eye health, particularly in glaucoma patients, it is usually taken alongside other treatments rather than as a standalone therapy. However, Dr. Greger emphasizes the importance of consulting a healthcare professional before using ginkgo, especially due to its potential increased bleeding risk, particularly in people taking blood-thinning medications.
An international team of researchers published a study in which glaucoma patients were randomized to nicotinamide or placebo for 12 weeks and then switched for another 12 weeks. And significantly fewer patients suffered further visual field deterioration while on the nicotinamide, 4% versus 12% while on placebo.
At number 4, we will explore nicotinamide, a form of vitamin B3. Nicotinamide has shown potential in protecting the eyes, particularly in preventing and slowing the progression of glaucoma, a condition that can lead to vision loss due to optic nerve damage. Nicotinamide plays a critical role in cellular energy metabolism, and its ability to support energy production in nerve cells is essential for eye health. So how does it work? Nicotinamide works by increasing levels of nicotinamide adenine dinucleotide, a molecule that is crucial for cellular energy production. Studies have found that individuals with glaucoma often have lower levels of nicotinamide adenine dinucleotide and may benefit from nicotinamide supplementation. In preclinical studies on animals prone to glaucoma, nicotinamide prevented the development of the disease in over 90% of cases. In humans, it has been shown to slow down the progression of visual field damage in glaucoma patients. Nicotinamide's role in protecting the optic nerve from degeneration is significant because glaucoma results from damage to this nerve, leading to gradual vision loss. By boosting NAD+ levels, nicotinamide helps preserve the energy balance in retinal cells and the optic nerve, protecting them from damage and degeneration. In one study published in 2020, patients with glaucoma were given either nicotinamide or a placebo for 12 weeks. Those who received nicotinamide showed significantly fewer instances of further visual field deterioration compared to those on placebo. This suggests that nicotinamide could be a valuable supplement for preventing glaucoma progression, though more extensive human trials are needed to solidify its role. Nicotinamide can be obtained from foods rich in niacin, such as mushrooms, green peas, peanuts, sunflowers, avocados, whole grains, and flavored cereals. While nicotinamide supplements are often used for therapeutic purposes, obtaining it from food sources can contribute to overall eye health. Dr. Greger recommends a whole food, plant-based diet rich in fruits, vegetables, and whole grains, which provides niacin naturally. At number 5, let's discuss what omega-3s are and how they can prevent and protect our eyes from different eye issues. According to Dr. Michael Greger, omega-3 fatty acids play an essential role in maintaining eye health and preventing various eye-related conditions. Omega-3s, particularly docosahexaenoic acid and EPA eicosapentaenoic acid, are crucial for the development and function of retinal cells, and they help protect the eyes from oxidative damage and inflammation. One of the primary ways omega-3s benefit the eyes is by reducing inflammation. chronic inflammation in the eyes, can lead to conditions such as dry eye syndrome and age-related macular degeneration. Omega-3s help improve the production of the oily layer of tears, which is essential for keeping the eyes lubricated. This reduces the symptoms of dry eye by enhancing tear stability and preventing excessive evaporation. More to that, omega-3s also support retinal health. DHA, which is a major component of the retina, plays a key role in protecting retinal cells from degeneration. Studies suggest that higher intakes of omega-3s can reduce the risk of developing AMD, a leading cause of vision loss in older adults, by slowing down the progression of the disease. Additionally, omega-3s may also help in preventing diabetic retinopathy, a complication of diabetes that damages blood vessels in the retina. Omega-3s improve vascular function and reduce inflammation, thereby lowering the risk of retinal damage in diabetic individuals. Omega-3s can be taken from plant-based sources rich in alpha-linolenic acid, which the body can convert to DHA and EPA. They include flax seeds and flaxseed oil, chia seeds, hemp seeds, walnuts, and Brussels sprouts. Dr. Greger typically suggests consuming around 1.1 to 1.6 grams of ALA per day for adults. This can be achieved by incorporating 1 tablespoon of ground flax seeds or 1 ounce of walnuts into the diet. For direct DHA and EPA sources, algae-based supplements are recommended at doses of 250 to 500 milligrams per day, depending on individual needs. Now that we've learned about the best 5 supplements that can protect your eyes and reduce vision loss, let's go over some great tips that can help you avoid dry eyes, which is a common eye disease.
A plant-based diet may actually be the best thing for patients with dry eye disease, those who wear contact lenses and those who wish to maximize their tear secretions. People with dry eye should be advised to lower protein, total fat, and cholesterol intake, and increase complex carbohydrates. Increase vitamin A content by eating red, orange, yellow, and dark green leafy vegetables. Increasing zinc and folate by eating whole grains, beans, and raw vegetables, especially spinach. Ensure sufficient B6 and potassium intake by eating nuts, bananas, and beans. Ensure sufficient vitamin C by eating citrus. Eliminate alcohol, caffeine. Reduce sugar and salt intake, and increase water consumption to 6 to 8 glasses per day.
Now, if you would like to learn more about how your diet can help prevent vision loss, watch this next video.